Hi, my name is Suzanne Mouton-Odum, and I'm a psychologist with Psychology Houston PC. And I wanted to talk to you today about body focused repetitive behaviors, or BFRBs. So, I'm a psychologist who treats BFRBs. What is a BFRB? Hair pulling and skin picking. So, hair pulling and skin picking are pretty common disorders. In fact, 1.5 to 5% of the population pulls their hair and/or picks their skin. This is millions of people in the United States alone. So why do people do this? Is this a sign of some sort of psychopathology? Is this a sign of an underlying anxiety disorder? Is this a sign of anything? And what we know through the research is that hair pulling and skin picking are really not a sign of anything other than a person trying to help their body feel better. Okay? And so the way we understand it is by looking at different factors. And the model we use is the comprehensive behavioral model, which I'll be talking about over the next week and getting into a little more detail. So just to give you an overview, for both hair pulling and skin picking, what we want to look at is 5 areas: the sensory, the cognitive, the affective, the motor, and the place. And all of these areas help us understand a person, why they might be pulling their hair or picking their skin. And so if you tune in next time, I'll tell you all about each one of them and how these apply to treatment and how we help people to feel better and not pull their hair and pick their skin. Because the most important thing I want you to remember about this and listening to this video today is that hair pulling and skin picking are treatable. We see people get better all the time with treatment, and not even with medication. Behavioral therapy has been found to be as helpful as medication. And so tune in next time and I'll talk all about the comprehensive behavioral model, which was developed by Dr. Charles Mansueto, who's from Maryland, and his colleagues there at the Behavior Therapy Institute of Greater Washington. And I'll tell you a little bit more detail about how we approach understanding BFRBs and how we treat them. So bye for now. Thanks.